Welcome everybody to Pre-Health Shadowing. Pre-Health Shadowing is a student-based, student-led organization focused on making shadowing opportunities readily accessible to pre-health students during the COVID-19 pandemic. Thank you all for joining us today. I'm going to go through a couple of housekeeping things, but before we begin, since Pre-Health Shadowing is able to connect students from not only places in the US, but all over the world, go ahead and drop in the chat where you're Zooming from today. Awesome, welcome everybody. It's a pleasure to have you join us. So just a couple things. If you are interested in staying up to date and never missing a virtual shadowing session with Pre-Health Shadowing, we do send out one weekly email with all of the speakers for that week, as well as the registration links and the Zoom meeting IDs. If you guys are interested in receiving this email, you can go to our website, prehealthshadowing.com/join us, or click the link in the chat. And what you're gonna do once you sign up is go to your email and find the Pre-Health Shadowing email. You might have to look in your spam, you might have to look in your junk, and maybe even your promotions folder. But once you find it, you're going to want to mark our emails as important. And then another thing that you can do is save Pre-Health Shadowing as a contact. And this just makes sure that it bypasses all of those boxes and goes directly into your inbox where you can see it when you want to see it. Pre-Health Shadowing does have closed captions for all of our live sessions for students with hearing disability. Pre-Health Shadowing has partnered with the women-led organization Mask for Mask, which donates 4 masks for every 4 masks purchased to someone in need, whether this be a hospital lacking in resources or people in the homeless community, or really anybody who just doesn't have the means to provide for themselves during this ongoing global pandemic. They have a bunch of really cute designs, and this is a great present either for yourself or for someone else that is definitely going to be a need for at least the next few months. So if you guys are interested, definitely check them out, www.maskformask.com, and you can actually get 15% off of your purchase, and you're helping 2 good causes at the same time, because when you donate your 4 masks, you'll also donate 10% of those proceeds to Pre-Health Shadowing to fight inequity in health education and promote diversity in the various fields. All right, we have also partnered with Fem Health, which is holding a Purpose Summit. This is a year-long membership to network and learn from 19 founders, CEOs, and leaders within healthcare. This is a group of amazing women that are all leaders. Some of them are owners and founders, CEOs of the multi-million-dollar companies. And one of them even appeared on Shark Tank. So super awesome, definitely something not to miss. Generally, the price is about $49, but we have gotten it down to $29. So you guys can get almost half off if you guys are interested. Go ahead and sign up with our link. You guys will be also helping Pre-Health Shadowing in the process. And this is just a wonderful opportunity for everybody. All right, here's a perk that we got from Kaplan for you all. All you have to do is put in your email and we will send you a 10% coupon code off of any Kaplan course. And you will get free resources, just like study guides that you guys will be able to utilize completely free. All you have to do is send us your email and we will put it in for you. Check us out on Instagram and make sure that you're following us. We will be posting a scholarship opportunity where you can actually earn a $2,500 scholarship to Kaplan. So if any of you guys are studying for any of the tests that are coming up, definitely utilize this resource. You know, this is from students for students. If you are interested in getting published, Pre-Health Shadowing is taking submissions for our blog. You can do this through our website, prehealthshadowing.com/blog submissions. You can submit articles, reflections, reviews, and success stories for the opportunity to be featured on our website. You can put this on any applications, CVs, resumes, and even your LinkedIn. Be sure to ask any questions if you guys are interested in the chat. We do have our editor-in-chief with us here today. All right, I do invite you guys to pull out your cell phones and to go to the camera. Once you go to the camera, you'll be able to scan your computer screen, and this will take you to a website in the Pre-Health Shadowing page called the Donate page. So like I said, we are a student-based, student-led organization, and we thrive off of the support from our community. We currently are struggling to keep our website up and free and accessible for all of our students. However, we have vowed to keep Pre-Health Shadowing free for our students for all of our shadowing sessions. So please help us by fighting inequity in health education by donating if you are able. If you are financially unable to donate at this time, we completely understand. All that we ask is that you please share this link with 5 people who you believe will be able to donate and help our cause. Thank you so much. Like I said, we do have our mentorship opportunity. So some details about this for all of you who are interested in sending in money for the raffle. You get the opportunity to meet with up to 2 established professionals per day of the event. Since this is a 3-day event, that's 6 professionals total that you have the potential to meet with. You get to network with them, see which ones you like, see which ones like you, and then you can connect with them and ask them to be your mentor. Everything else is completely up to you. So you guys can submit an entry into our raffle. If you guys missed the beginning of the session and you'd like to get involved into our mentorship networking event, you can send in a $2 Venmo or PayPal per entry that you'd like for our raffle to @PreHealthShadowing. If you guys are interested in helping out, this is a student-based organization. You can become a student volunteer. We have a bunch of opportunities laid out for you guys. If you're super busy, it's okay. And if you still want to help out, we have asynchronous opportunities for you guys where you can help us with student outreach and professional nominations. We also have a handful of hands-on projects that involve creative design, animation, web design, marketing, advertising, and research. So if you guys are interested in getting involved in any of those, feel free to check out our website and sign up for volunteer. If you guys are looking for a leadership role that is 100% remote and it gives you the opportunity to network with students across the globe, I definitely recommend that you apply to be a student team member. And I'll talk a little bit more about this at the end of today's presentation. For our high schoolers, we do have a high school training program, and this is the opportunity to establish pre-health shadowing as a club on campuses across the US. And so if you guys are looking to network with high schoolers who are also interested in potentially going into the healthcare field, this is your chance. You can sign up on our website through the regular application. Just mention that you're interested in joining for HTP. For those of you joining us in our live session today, feel free to post us on your social media for the chance to get reposted on our official page. You guys can tag us @PreHealthShadowing, and we would love to see your whole setup for today. So with pre-health shadowing, students can take a post-shadowing assessment to receive a certificate that verifies their virtual shadowing hours with us today. So I encourage you guys to take good notes and ask our professionals some amazing questions. This is a wonderful opportunity that we get to have. Feel free to drop those questions and comments in the chat throughout the session, and members of our student team will be sure to ask them during the Q&A portion of today. Without further ado, I would like to welcome to you our professional for today. We are honored to have a pharmacist with us. So welcome. It's a pleasure to have you.
Thank you so much. All right, so let me go ahead and share my screen. During the talk, I will talk a little bit about myself and just my journey in pharmacy, because I think it's important to just kind of understand just the diversity in pharmacy, and so my story kind of shows you all of the different opportunities. But I will start off by saying that my name is Dr. Rachel Ogden. I'm the Dean for the School of Pharmacy at Lake Erie College of Osteopathic Medicine. It's located in Erie, Pennsylvania, that's where I'm located. It's a 3-year accelerated program in Erie. We also have a Bradenton, Florida campus, and we have a distance education pathway. So the Bradenton, Florida campus and the distance education pathway are 4-year traditional pathways, but because we are very, very student focused, we have multiple pathways so that we can fit all needs. So I just wanted to tell you about me and about the school, but I'll tell you more about the profession as we go. So really the purpose for tonight, as you know, is a shadowing event. And I'm gonna go through pharmacy and opportunities in pharmacy, but I'm gonna do it as if you are my students. And so we're gonna talk a bit about the different types of practice, what you would see. We're gonna work through a case, and I wanna share with you my thought processes of how, when I had opportunities to to work with patients and make recommendations on medications, how, we actually went through that process. So there's a plan of care that pharmacists use, just like there's a plan of care with all healthcare professions. So I think it's important for you guys to see that. But we really, this year during the pandemic, the fact that pharmacists are so essential and so accessible very much came to light. So, you couldn't escape all of the news stories about people, wanting to get tested for the COVID virus, and, the availability of testing. Now it's the availability of the vaccine and where can we get it? And just, it really showed how the use of pharmacists in the community and the accessibility of pharmacists in the community really allowed for us to serve the public in such a way that other professions couldn't. But when you think about the pharmacy profession, and actually this quote about essential providers, accessible care, that was the theme for this year with the American Pharmacist Month, which was in October. And it really wanted to focus on the fact that we are an integral part of the team. And if you think about treating patients for diseases and illnesses, 80% of the time it's some type of medication that's going to be either prescribed or recommended over the counter that treats that particular ailment. So the pharmacist, who is the one who's really optimizing the treatment through medication, they're so essential. And I'm just happy to have an opportunity to share some of this with you tonight. So can I get to know a little bit about the audience? I know it's a pre-health shadowing, but what is your scope? Where that's actually my first question. Where, how far along in school are you?
Alrighty, I went ahead and opened the poll. Go ahead and send in your response. I'll leave it open for a couple more seconds until we get a little bit more participation. Alrighty, I'm gonna go ahead. Feel free to take a look around the room.
Okay. So yeah, it looks like third year was the most
the winner.
Frequent response. Yeah. So in pharmacy school, or when you're going into pharmacy school, you don't necessarily need to have a bachelor's degree. And so joining me actually is our admissions counselor from LECOM. I hope you don't mind that I dragged him along, Jordan Coper. So he's here with us tonight too. So anyway, you could have a 2 years of the prereqs, or you could have a bachelor's degree. Some of our students come in with a master's degree, but you can vary, I guess, as far as what you need to get into pharmacy school. So there are different types of settings, and it's important to know that. And all of us have different strengths. All of us are, want to gravitate towards different areas. One thing that I tell my students all the time is that you have to have good communication skills. So as I told you before, medications are 80% of our treatment. But if a physician prescribes a medication and there's really not a good understanding of how to take that medication, the pharmacist's role is really the educating, coaching, getting the patient to adhere to that medication regimen. And so if you can't teach the patient why this medication is important and how to take it properly, the success of that medication regimen really isn't going to happen. So there's pharmacists in the community, as I said before, very, very accessible. There's also mail order pharmacies that do dispensing in an alternate way. Still, those pharmacists still communicate with patients, just perhaps not face to face. We have other settings that pharmacists are in. The hospital, of course, is a popular setting, but also in clinics, physicians' offices, in outpatient care centers, home health, hospice are other roles for pharmacists, long-term care settings, where we service nursing homes and other institutional patients. So all different types of settings. The focus may be a little different depending where you are. Is your patient an independent person who, is in the community, or are they more frail, perhaps in a nursing home? So the focus may be a bit different, but the goal is always the same. It's the optimum use of medications. And there are some individuals that go into pharmacy that really decide, I don't know that I want to be part of patient care per se. I really am so excited about medication therapy. I'm excited, to make a difference in the health of the public. You can do other things. So, industry research, government agencies, the insurance industry. So, there are pharmacists that sit in, with insurance companies and decide about formulary medications and other things. And when you think about industry, and once again, there's been so much light shed on various things. Some of it's been positive, some not so positive. Some things are, you don't always get the truth. You get maybe some versions of the truth, but there's been so much that's been talked about in relationship to the development of these vaccines that are coming, to the public now. And so just think about everything that went into the development. So, yes, manufacturers have developed vaccines in the past, yes, but this is a new type of formulation that has been studied and tried, but hasn't been as widespread as what is happening now. So there's what's happening in the labs, what's happening with the research, then comes the trials, then comes the communication of the information, and the education to the public, the education to physicians, the guidance that's given, the prescribing information. Pharmacists are involved in various steps along that process, and it's very important that they are. So, if you have an interest in medicine, but want to more optimize the use of medications, working with the patients, it's, the prescribing of a medication is one thing, but there's a lot of monitoring and follow-up that goes along with the management of, not just, as I'm talking about the virus that's occurring, chronic conditions, diabetes, hypertension, osteoarthritis, things that will stay with a person for a long time. The patients need help in monitoring their meds. They need help making recommendations back to the physician as far as optimum therapy. So that's really the role of the pharmacist. So I want you all to have a good foundation as far as where we are in our avenues of practice. So I talked kind of in a broad sense about pharmacists and PharmD. So pharmacists are doctors of pharmacy. We all graduate with a terminal degree of Doctor of Pharmacy. In medicine, residency is an automatic part of your education. In pharmacies, in pharmacy, we graduate with our doctoral degree and then we get licensed. You can decide, it's optional, whether or not you want to go on to residency. Now, as you can imagine, there's so many medications and more medications come out every year. And it's important for all pharmacists to keep up with everything. But there are pharmacists that want to become more clinical in nature. And I use that term. I don't like to use it because we're all clinicians, but I will say working in a hospital, rounding with physicians, specializing in a certain type of pharmacy like oncology and or psychiatry, and there's board certifications for pharmacists in every type of practice. I actually happen to be board certified in geriatrics. So there's specialization that occurs in pharmacy, and to do that, residency usually occurs. Individuals that go into academia and work with teaching facilities usually have a residency and then go on to practice. So our residencies are a bit different, though. They happen after graduation and licensing, and which is a little bit different than medicine. But it really just gives you an opportunity to have more specialization. And then if you want specialization, but perhaps not in the clinical nature, there are fellowships. So you can work in manufacturing, as I said before, but you also can work at the other end of it, working with the clinical trials, working to create published information that is occurring from those clinical trials. So that's another role for a pharmacist. Okay, so there's been a lot of talk about the profession recently, and the fact that in the community setting, there isn't as much growth as there has been in the past. One thing, though, that the pandemic did do for the profession of pharmacy is it really kind of took the lid off and showed that point of care testing in the community in a pharmacy setting is really the best way to handle public health issues. And so in a scope of pharmacist practice, we've done point of care testing. So we can test for the flu, we can test for strep, we can give you, an antibiotic or an antiviral in the community setting. But what has happened, with the pandemic this year, and you saw, I'm sure in your communities, you've seen the tents that were set up outside of various pharmacies and the testing that had occurred. And now the mass vaccination clinics that you're going to see go on in your communities. That'll be in the community setting, and that will allow for more growth. So, places like Kroger's and CVS have said, we're bringing on thousands of pharmacists to help meet the public's needs. But really, a lot of other areas of pharmacy that aren't as popular, they're going to see a higher growth. So I talked before about working with patients, helping to manage their chronic diseases, helping to try to get to their goals of therapy with their medications. That's happening in physicians' offices, right now, outpatient care centers, home health offices. That's where we're seeing the real growth. So in an outpatient setting, typically there was pharmacists in a hospital setting doing patient education at discharge and providing a lot of that care. Well, now we're seeing that it's not just in the hospital that should be happening. We need that in a physician's office. We need that as part of home health and hospice. We need that pharmacist connection with the patient through the continuum of care. So that's really where the growth is occurring. So when you're thinking about the health profession that you're drawn to and what you may be interested in, understand that working with the patients with their medications can be at any part of the continuum, not just in the community setting at a pharmacy, or not just as part of a clinical team in a hospital. It's occurring everywhere. Okay.
Just 1 second, Dr. Ogden. Looks like we have a couple questions, actually.
Yeah, they're actually they're gonna manage the questions for us, Jordan. Maybe you can get that.
My bad. I'm sorry.
A full service group.
Sorry.
Okay. I'm just gonna.
We're used to doing things like, sorry.
We're a tag team.
Yeah.
Okay. So when you talk about the experiences from day to day, and so I've been a pharmacist for over 30 years, and I have had many students in clinical settings and precepted them, and really acclimating them to the particular site and what our responsibilities are at that particular site did kind of vary depending on where I was. So we talked about, a little bit about the community setting and the things that happen. You're leading a team of technicians. You may be, you may be the only pharmacist. There may be a few pharmacists, depending on, how busy that particular pharmacy is. A lot of direct patient interaction because, they're bringing their prescriptions, you're providing immunizations. You can provide other clinical services at a community site, blood pressure monitoring. We do DEXA scans, a variety of different things. In a hospital, I spoke a bit about that too. Usually you are monitoring the therapies that are happening to the patient. But, patients don't stay in the hospital as long as they used to. Patients are just there a few days and on their way. So it's a matter of making sure that any medication changes that happened within the hospital are communicated to that patient before they leave. It's, making sure they're educated on any medications that begin. It's working with the doctors while they're in to make sure that, the proper treatment is happening. And then the last bullet talks a bit more about the government agencies and constructing policies and advocacies. Some people go on to be part of national organizations that are a part of pharmacy. But no matter what the setting, it's always about optimizing the patient's health through the proper use of medications. And sometimes, I told you that I'm a geriatric pharmacist. Many times in the nursing home, discontinuing a medication was the thing that would best help the patient. So yeah, it really depends on the setting. So here's our next polling question. Let's see what your knowledge is of medications. So what I have up there is 4 generic names of medications, and I want to know, do you know which one of these generic names corresponds with the drug Tylenol? So tell me, which one of these drugs is the generic name for Tylenol? And most of the time, if you buy Tylenol, you're going to be buying it generically anyway. So it should look familiar to you. Let's see if you can get it.
Okay, we'll wait a few more seconds to get some votes in. Okay, I'm going to close the poll. If you haven't responded yet, go ahead and pick one.
Okay, good job. 89%. Acetaminophen. That's the right name. And did you know how to pronounce it correctly?
I never did until I started working for LECOM.
Okay, so let's continue on. All right, so I'll go through this quickly because I want to spend some time on the case, and I want you to hear the thought process of a pharmacist. But I want you to know that we all have strengths within us, and we have things that are part of us that draw us to different areas. I do believe I knew I wanted to be in healthcare, and I knew I wanted to provide that service. It interested me. But there's a part of me that longed to be a teacher and a coach. And so I think that no matter what type of healthcare you go into, you're always going to be an educator because you're always working with a patient and you're always having to explain certain things. But the problem solver in me loves looking at somebody's medication list and breaking it down and, trying to see whether, they're doing great or they're not doing so great, and what can we change. So I guess I just want to tell you that no matter what the setting, no matter, what type of pharmacy you go into or what type of healthcare you go into, our strengths kind of always rise up. And so it's the part of you that wants to serve and wants to help people, wants to educate them and coach them. That's what makes a great pharmacist. But anyway, so I received my bachelor's degree from Duquesne University, which is in Pittsburgh, Pennsylvania. Later in life, received my PharmD from the University of Florida after I had practiced for a number of years because I wanted that doctor of pharmacy degree. Started off in community practice early on because I was a people person, and I thought the only way you could interact with patients was to be in a community pharmacy. But I later learned as I transitioned to hospital pharmacy and loved working with nurses and physicians and doing that discharge counseling with patients when they were discharged. Hospital pharmacy was a fantastic place for me too. I spent 11 years in a hospital pharmacy, developed many protocols for treatments of various diseases, helped the OR staff, develop protocols for various things. And in hospitals, this happens in every type of pharmacy, but in hospitals especially, you're always looking for the most efficient way to use your resources. And not to get too much into the whole, hospital arenas, but hospitals are reimbursed by what are called DRGs and diagnostic related groups. So let's say I'm getting my appendix out, bam, the insurance is going to reimburse me X amount of dollars. Well, whenever they decided these dollar amounts to reimburse, they didn't think about drug costs. So one of my roles when I was the director of pharmacy for a community hospital, one of my roles was really trying to figure out how you can really be efficient with your formulary and with your costs. So that's another great aspect of pharmacy. If you love, of quality improvement and trying to really think of the most efficient way to do things. Anyway, from there, I was drawn to long-term care pharmacy in the elderly, our most frail population. I wanted to make a difference with the elderly, and that took me into academia. When I went into academia, I'm a student and I'll be a student for my whole life. So I tacked on a few more degrees, a master's in medical education and a master's in health services administration. But it's been a wonderful journey, and I love talking to students. And I have students that in their first year, they come to me and they say, Dr. Ogden, I don't know if I want to do this. And we really talk about what's the reason why you started and what is it that you want to do. And maybe you are struggling a bit right now, but you're gonna meet a patient someday that's struggling too, and everything that you've gone through, you're going to share with them and be able to help them. So I love situations when I can talk to students and really kind of bring out in them what's going to really make them be a great healthcare provider. So just a little bit to know about how you get there. For those of you that are interested, you can always contact me at our school, or contact any pharmacy schools. But course, you just need at least 2 years of coursework. Every school has their prereqs, letters of recommendation. Some schools require a PCAT, and we don't. We look at other parts of your profile. So just some advice to you, because you're undergrads and not quite in the pharmacy arena yet. This is great that you're participating in something like this. Get as much shadowing experience as you can. Talk to pharmacists, build relationships, try to do as much research in different types. Don't just go to a community pharmacy and then think, oh, that's not for me. Talk to a hospital pharmacist. Look in, the internet can tell you everything, every type of pharmacy practice that's in your area, you can investigate and talk to. Okay. Number 3 poll question. What are you studying right now? What is your major?
Okay, for those of you who haven't responded, I'm going to give you 5 more seconds. Okay, thank you, everybody.
Okay, biology, great. So that was my love too. When I was in school, I was a biology major and then did transition to pharmacy school after 2 years. But a lot of times individuals will say, "Oh, I don't want to go into pharmacy because I don't like chemistry." And drugs are chemicals, yes, and you do have to know some chemistry. But what's really interesting about medications is that you learn about their chemical structures, but it's how those chemical structures act in the body. So it always goes back to the body and the pharmacology, meaning, what receptors do we have in the body that these medications act on. So no matter what your background, we've had other health professionals that have transitioned to pharmacy. So math, science, communication, psychology, it's all an interest. So here's just the process of getting into pharmacy school. You know, the application cycle opens up usually in July. You have an interview, acceptance, and then you transition to pharmacy school. And just to kind of quickly take a look at what the curriculum looks like, there are clinical experiences in pharmacy, so your introductory experiences are usually after the first year. And then your final year is usually all advanced practice clinical experiences. So at the LECOM School of Pharmacy, our curriculum will be a modular-based curriculum. It's based on the body systems. And so we take you from kind of the basic sciences of anatomy and physiology all the way through the actual treatment of disease with the medications based on the body system. So you can learn about the treatment of the patient and clinical aspects of pharmacy early on in the curriculum. You don't have to wait until later in the curriculum. Okay, so this is what I've been wanting to get to because I want to go through our case. And I don't know how much background you have, but that's okay. Because what I want to do is I want to show you the process of how pharmacists approach making recommendations about medications and how we think about patients and patient care. So as I said before, every type of practice always has a plan of care. You know, if you're a nurse, you develop a care plan for direct care. A physician will have kind of a SOAP note where they kind of say, you know, this is what I've observed. This is what the information that's been given to me. I'm making an assessment, and this is my plan. Pharmacists do the same thing, but it's tied to the patient's diagnoses, their medications, and their information that we get on the actual physical exam. So this is a 52-year-old white female, and you see some of her information. So vital signs are what we observe and monitor and measure in the patient when we see them. So the blood pressure is there, 138/72. The temperature, her oxygen level, her BMI. Then we have some information on her cholesterol, which is lipids. So lipids and triglycerides kind of go hand in hand, and that information is there. Also her liver function test. So we're taking a look at how her liver is functioning. Also, you have her electrolytes, which is, you know, the calcium, the chloride, the potassium, and the sodium. And then some of the blood gases and other types of things. So A1C is hemoglobin A1C. That's a measure that we get with patients who are diabetic. And so you may or may not know that number is a little bit high for a patient. Her glucose is also a little high, but that might not be a fasting glucose. So, you know, we don't know the last time she ate. Blood pressure, not too bad. Triglycerides for sure are high. So what I'm doing is I'm kind of going, this is what I would normally do. I'm looking at all the information for this patient. I haven't seen anything else yet, but what I'm noticing is the things that aren't within normal limits. So that's what I'm going to kind of take a look at. The LDL and HDL, not too bad. Not too bad, but boy, those triglycerides are kind of high, and the patient is diabetic. Okay. So now we're going to go more into the history. So the way a pharmacist thinks is we look at the diagnoses on the left-hand side. And I believe the next slide is you're going to get to see the medications. But automatically what we do is we start matching up, okay, is every problem treated with a medication? And if it's not, it doesn't have to be, but if it's not, what's the reason why? If I go through all the problem list or all the medical diagnoses and I still have about 3 or 4 medications that are hanging out there, well, then I'm going to have to ask myself why. If there's no diagnoses tied to this medication, is it necessary? Or do we just not have a complete medical history? Surgical history is there too. And then the blood glucose log. So this patient is diabetic, correct? Yes, the patient has diabetes. So we ask these kinds of questions. You know, you have to think about what kind of symptoms is the patient coming to us with that we have to acknowledge? And if they're on medications, is it being optimized, not being optimized? So a blood glucose high of 320, not so good. Low of 46, that's not so good either. They should never go that low. Average is around 140. I'm not thrilled with that, but the average doesn't tell me a whole lot. And what I would probably like to see is if they brought me their log from, days, how, show me what you've done the last few weeks or the last month. More information better, more data better. Oops, sorry about that. Okay, let's go to the next. There we go. So here's the med list. And as I said before, and I think on the next slide, or maybe the one after I tell you what the things we check for. But here's all the different medications. And I appreciate the fact that they are telling me what they take once a day or twice a day. And as I said before, I would match them all up with their particular diagnoses. The as needed medications are there, and the over-the-counter medications and supplements. Notice this leftover medications from surgery. So people love to keep their leftover pills just in case, and not even just in case they may need it, but maybe my, granddaughter, brother-in-law, somebody, they may have a use for it someday. So that's why I'm so excited to see more and more pharmacists working in home health care, because I think visiting patients, especially elderly patients, in their home to see how do you store your meds, what do you have hanging around that expired 5 years ago, throw it out. It's an important role for a pharmacist. And adherence, meaning do people comply with the way they're supposed to take their medications? Adherence is a big problem. And we could save this conversation for another time, but the amount of rehospitalizations and problems that come from adverse events because people aren't taking their medications the way that they're supposed to is a shame. And we could save a lot of healthcare dollars in the United States if we paid more attention to whether or not patients were adhering to their medication profile. So here's their list of drugs. Now, what I think is important for you to know is that when a pharmacist looks through a person's medication list, they do a scan. This is the way we do our plan of care. We look to see, do you have conditions on your history that are not treated? So we match up the drugs and the diagnoses. Is it the right selection for you? Is there something that I'm finding either with your symptoms, your age, your other values that tell me that's not really the right proper drug for you? Is the dose subtherapeutic, meaning too low? Is it too high? Are you having a problem, getting your drugs or adhering? Are you having some kind of interaction or adverse event? Or am I using a drug and there's really no indication for it? So, if I had $1 for everybody that was on a PPI, which is an example of that would be Prilosec or Nexium, and there's no real reason for it, they just started taking it and then just never stopped. So drug use with no indication, and we call that an unnecessary drug. So that's how we think about it. We scan that profile list, we look at their symptoms, we look at their measures, those lab measures that you saw earlier, and we try to find some things out, and we interview the patient, we ask the patient, which is important if you want to find out good information. So this is what I did. I took the diagnoses and I matched up all of the medications that they were taking that may be for that particular drug. Now I left one out. So there were 2 drugs that were for depression, sertraline, and I think Cymbalta, I feel like also was on there. There was 2 drugs that were for depression.
Yeah,
so,
Cymbalta was on there.
Thank you. That should be assessed. But here's just the matchup. So you could see that, yes, all of the diagnoses were actually were with a particular medication. So this is the assessment. And so if you look through, you can see that this patient had some interactions with their aspirin and Advil, which they were taking for their arthritis, could actually have an interaction. Primrose, which they were taking as a supplement, there would be an interaction. So you have the rationale for what your assessment is, and then what you want to recommend to the physician. So that's what's under the actual plan. A necessary drug is listed there. Remember, we said that they just had saved it from their last, the last time they needed it. Non-adherence. So I didn't point this out, hopefully you picked it up. They had an inhaler, but it was empty. They had not gotten it refilled, and it might have just been as needed. A lot of people that have asthma or problems, they just need something as needed when they're short of breath. So that was not so good. And then, not knowing what your knowledge base is when it comes to particular medications, but just to know that that patient was on a number of medications for hypertension. And some of them actually had mechanisms that blocked each other. So because of that, we would make a recommendation of using a more cardio-selective drug within that class. So at first glance, when you look at that patient's profile, you may not think that there was much going on, but under the surface, there was quite a bit going on as far as adjusting some meds. And really, I hadn't even gotten to some of those lab values that were not quite optimum. So interactions, again, there's the recommendation. Additional drug needed. So with this particular patient who's in her 50s, it's interesting because with treatment of hypercholesterolemia, depending on your age, and even with diabetes, depending on your age, the recommendations are different. Whenever you have diabetes, and especially if you're at a younger age, physicians are going to treat very aggressively. They're going to want your lipids to be very low. That patient had very high triglycerides, so they're going to want to attack that. And the reason for that is when you optimize drug therapy or maximize drug therapy in patients like this with hypertension and diabetes, when they're younger, you really decrease the risk of them having a stroke or another type of event as they get older. So that's why the recommendation here was to start this patient on an additional medication for cholesterol. Diabetes was, the average glucose was 140. I told you that high of 320 was not good. And that wide range of 320 to 46, not good at all. So this recommendation was Levemir is a type of insulin. The recommendation was to split the dose so that you have a more balanced therapy, and then to tell the patient, and you work with the patient, please keep monitoring your glucoses. Let's figure out the best way. And doxycycline was on the drug list. Doxycycline is an antibiotic, not really used for chronic use. Not sure why it was still hanging around. So that's something that we would have recommended to be discontinued. Okay, so I went through that kind of quickly, but hopefully not too quickly. But I really wanted you to see the thought process as far as how we approach a patient and what we would do in that situation. So making sure that we really optimize the patient's medications and make sure they're progressing towards goal is really what's important. So having that accurate drug list, knowing their most recent labs, knowing their diagnoses is so important. And this is just kind of showing how those building blocks all go together. So based on everything that I've told you, what do you think the most important characteristic of a pharmacist is?
All right, poll is up. People can now vote. It looks like we had some good listeners during the presentation. All right, give it 5 more seconds. You have almost everyone voting. 3, 2, 1. All right.
Voted in that poll, you were correct. Okay, so lots of information. I hope that I really stimulated your thoughts. I hope we have lots and lots of questions that I would love to answer, and I'll do that at this time.
Thank you so much, Dr. Ogden, for a wonderful presentation. We did get a lot of questions in the chat, so let's get right into it. So one of the first questions we had was, how do you think COVID will affect the role of pharmacists in the long run?
I think that the pandemic itself, as tragic and scary as the last year has been, there was something called the Public Readiness Emergency Preparedness Act. I don't know. I always mix up the P's and the whatevers, but the Department of Health and Human Services federally said, look, there's certain things that we're going to enact. It doesn't matter what the states have as far as regulations. We're telling you that all pharmacists, all pharmacy interns, which means pharmacy students, and pharmacy technicians need to be able to order COVID testing, perform COVID testing, and then ultimately when the vaccine becomes available, vaccinate. And the reason for that was because we are so accessible in the community. So did our scope of practice change much? No, not really. Yes, state to state, some of the regulations vary, but what this did was it showed at a widespread level that pharmacists need to be able to respond to the public, not just in pandemics, but all the time. And I think about the whole, populations, but I especially think about the underserved individuals that maybe don't, there's some places in Erie County where I live, in Erie, Pennsylvania, who they don't even have a physician that's in their community full time, but they probably have a pharmacy, so I think that it just really showed that at a national level, we have to acknowledge more the role of the pharmacist. But it's something that we in the profession knew along. We know the impact that we're making, not just in times of emergency, but managing patients' chronic diseases and helping them with that. So that's how I think.
Thank you for sharing. Another question we had was, how is the work-life balance of a pharmacist? Can their schedules be flexible?
Yes, and actually, one of the things that is a kind of a draw for pharmacy is that there is a lot of flexibility. It's a great profession as far as financially rewarding, which, we all, we go to college, we spend a lot of money. We're smart individuals. We're going to a graduate school. We're getting a doctoral degree. So to be able to come out and make, $100,000 a year is nice. And there's flexibility. So, I can work in a community pharmacy and I don't necessarily have to be on call. I can have a flexible schedule, work weekends if I want. Maybe if I don't want to work weekends, I don't have to. In a hospital setting, it's a bit different because it's a 24-hour operation. And a lot of times you do have to take call. But usually it's the clinical staff that's on call because the inpatient pharmacy is usually open 24 hours. And the scheduling becomes even nicer if you're maybe in a clinic, that maybe isn't open on the weekends or other types of situations. So lots of variety, but it helps create that work-life balance. Now, if you're a healthcare professional though, no matter, you're usually pretty devoted to your profession and your career. So we have trouble with work-life balance anyway, which has nothing to do with our profession. It just more has to do with the types of people that go into the profession, but it's definitely possible. And I know that's important for young people to have that work-life balance.
Yes, for sure. We always get that question of work-life balance. Thank you for
Yeah.
answering it so honestly.
Yeah.
One other question we had was, what are the main differences between a pharmacist and a pharmacy scientist? And why did you choose to become a pharmacist?
A pharmacy scientist? Is that what
Yes, I think that's the question.
Okay, so when I think about that question, I guess I'm just going to answer, you know, how I perceive it. A pharmacist is a healthcare professional who deals with patients. We're clinicians. Okay. Now you don't have to be a clinic. You can get a doctor of pharmacy degree and you don't have to be a clinician. There's many people that gravitate more towards the sciencey side. So you can do research. You know, you can work in a lab. Pharmaceutical scientists get PhDs because that's what their passion is about, and that's what they're interested in. So they're more on the science side, whereas a pharmacist is more on the patient side. And for me, you know, as I said before, I wanted to help people, serve people, and that's what a pharmacist does. But you know, as I had showed you the different areas you could go into, doctors of pharmacy have a nice background that they can go into industry, and they have that clinical training of their last year of rotations that helps them. So it's not all science. But if you love science and that's what you want to do, that's a great thing for you too. But to me, that's the difference.
Thank you for elaborating on that. A kind of related question we had was, is pharmacy a rewarding career despite not necessarily being able to watch how your patients directly progress through treatment? And are pharmacists as social as doctors with the patients and families?
Wow. So we do get to watch them progress in treatment because they come back for refills every month. So we definitely get to watch them. And you have to think about it. So once again, you go to see your doctor, you have something wrong with you, you go to see your doctor, and they prescribe a medication, and then you have a follow-up, come back in 3 months and 6 months, depending on what the ailment is. Now, obviously, if you are an oncologist who's treating cancer or other things, you're gonna go through treatment with that patient. But you have to understand, there's always a pharmacist who's filling that med. So we do see them, and it's so rewarding because they take the time to talk to us and tell us how it's going, and if they need something, let's say that they need something to treat their cold or their pain or something that they're going to self-care. Well, they talk to the pharmacist because they want to make sure that nothing interacts with their prescription medications. So it's so social because people will come in and talk to me, and when I worked in a community pharmacy, and their child isn't feeling good, so they may come in and talk to the pharmacist first before they call the doctor, and that very, very social, very social.
Thank you for offering that perspective, for sure. Kind of along this thread line of, how do you think pharmacists can help reach underserved communities that may be distrusting of medical care? And in what ways are physicians responsible for this versus pharmacists versus outpatient providers?
Wow. Okay. So I hope I remember all the components of that, but I think we all have a responsibility. And one thing that you all will learn and hopefully, you'll go into one of these types of healthcare, and I hope it's pharmacy, but we all have to work together. Interprofessional treatment of the patient. So the patient should always be at the center, and then all of the providers around the patient, doing what's best for the patient. But we all need to be in those underserved areas. So I have had the really great opportunity of partnering with one of our underserved community agencies. And I've been going every Wednesday and providing COVID testing for individuals that wouldn't normally go to get tested, but they will come to their community, place where they go to. So it's not just the COVID testing, but I should be in there, talking to them about their medications, like having what we call a brown bag event where everybody puts their medicine in a brown bag, comes in, and we give our time, we volunteer our time to go through the medications, talk to the patients about their medications. Whatever we can do. A lot of times it's education. A lot of times it's building trust, building relationships. And it's just devoting your time, going to churches in places that have underserved populations, and having a health fair. We had a big push a few years back through the American Heart Association, and we went every weekend on Sunday. We would go to a church and do blood pressure screenings after the service. And it was every week, I think, for so many months. But we identified lots of patients who had high blood pressure and needed to see a doctor. So it's just simple little community things like that that get us out there and get people seeing us. And then maybe, they'll follow up. But pharmacists have a responsibility, physicians have a responsibility. Whatever we can do together is the most important thing.
Definitely. Thank you so much for speaking on that. We had one question that said, I understand that factors such as body type, weight, and pre-existing health conditions might affect the dosage, but are there occasions where a completely different drug is needed? And what do you do when you feel that a medication that's prescribed to a patient is not appropriate for their treatment?
Yes, there are times when a completely different drug. So, I mean, I can speak to this when it comes to elderly patients, but it happens with other patients too. So there's been studies that have been done in elderly patients, and what has been found is that certain medications, certain drug classes, and certain medications actually cause more harm than good in an elderly person. Let's say it's a type of antidepressant or a certain drug class. So maybe with that patient, a different drug class would work better, or maybe starting with a non-pharm therapy, meaning no drug at all, maybe just a behavioral change, or let's try something different. That does happen. And pharmacists call physicians and tell them why, what the evidence is and why they feel the way they do, and have the conversation. And many times the physician will agree with the recommendation of the pharmacist. So this happens a lot with the elderly population, but there could be, so, you may or may not have ever heard the term of pharmacogenomics. So there's a lot that's being found that if you have certain genetic makeup, it affects the way you respond to a medication. And so I'm not saying every pharmacist would have access to somebody's genetic makeup, but if a pharmacist has particular information about a patient that will predict perhaps the way that they would respond to medications, of course we would make the recommendation. I think that answered the question.
Yeah, it does. Thank you so much for answering. Again, similar vein line of what do you do when you find out patients have been sharing their medications with people close with them that have a similar condition or symptom? How dangerous is this?
It is dangerous. So you have to, one thing you really have to do as a healthcare professional is never, yell or scold your patients in a way that creates a barrier or tension with them. You can't. So what's important for pharmacists to say in the beginning with the patient relationship, and when you're educating a patient, is to say it's important that this is prescribed for you and should only be used by you. I guess I just kind of, I have to go by the safety realm. Like I know that you understand what this medicine is for, but you don't necessarily know all of the medications that your friend or, relative is taking, or you don't have the knowledge. I mean, I don't always come out with, it's against the law to do what you're doing, but but I just try to do it in a way that says, it's just not safe. It's not safe to do something like that. And we wouldn't want anything bad to happen.
Thank you. I think that's another place where communication is key, and so is
Absolutely.
delivery.
Absolutely.
So we have some more questions that were focused on specifically like pharmacy school. Like we had one that was, how important is GPA to get into, as far as getting into pharmacy school?
So, I mean, as you can imagine, it's important. Everything about you is important though. So one thing, so I've been with LECOM for 13 years, and Jordan, who's with me tonight, has been with LECOM for a number of years. I will tell you that we look at the whole application. So we don't automatically rule someone out just because, I mean, you have to meet our minimum GPA, but we look at someone and we look at what their experience has been. We look at their personal statement. We want to talk to them during their interview. We want to know about their passion. We want to know how hard they work. And sometimes your undergraduate experience doesn't always, like if you just look at the numbers, of course, good numbers are good, but it doesn't always reflect your passion and how devoted you're going to be to pharmacy and your patients. So I just want to make it clear that you always should try your best, but don't count yourself out if you think that your GPA is not high enough. Or, if you have an opportunity to take a course again and get a higher score, like in sciences or math, or to show, look, this is what happened. It was my freshman year and I didn't know what was up or down, but I'm a junior now and I have a lot of passion and this is what I want to do. And yeah, that first semester really kind of affected my GPA. That's what we look at. And I'm being honest. It's not all just, let me see the numbers and it's, thumbs up or thumbs down. We look at everything. If you spend some time in a pharmacy and understand a bit about pharmacy, that's great. Is it absolutely necessary? No. But for your own benefit, you should do some shadowing for sure.
Thanks for sharing that. Again, someone had a question of, what's your opinion on pursuing a degree that may not be in that field of science? Would you recommend that pre-L students stick with the stereotypical biochem majors, even if they have other interests?
I'm not sure I understand the question.
I can repeat it. It's okay. So someone was asking if they should stick with the stereotypical biochem majors in undergrad, even if they have other interests.
So, and I guess what I don't know is what those other interests are. So for me, if you're gonna go into any of the sciences or the healthcare professions, for sure, you're gonna have to have the foundational sciences, and for pharmacy, you're gonna have to have some math too. If you have other interests, that's great. And really for pharmacy school, now in California, it may be a little bit different as far as what schools require. I just remember, I thought I had heard that maybe not all schools, but some of the schools in California require a bachelor's degree before it being admitted. And I don't know if that's true for all of them, but in Pennsylvania or at LECOM, we don't require a bachelor's degree. So if you're only going to take the prerequisites, which is just over 2 years, you're gonna have to take a lot of the sciences, but you'll have some general courses too. So I mean, my advice is, do what's best for you, but, the more practice you can have in those courses before you get to pharmacy school is a good idea.
Thank you. One question we had was, what were some difficulties that you faced during your first year of working as a pharmacist? How did you overcome them?
We're going back to 1986. That's how far back we're going. You weren't, were you even thought about back in 1986? Probably not.
I wasn't.
So the challenges, well, the challenge was, just really accepting that huge responsibility that I had. So I was in a community pharmacy. In a community pharmacy, you're handing that drug over to the patient. It's, so you're checking for safety, you're checking for efficacy, but you're the last step, you're handing it over. In a hospital situation, the nurse is doing the administering, she's got to check your drug against the order. So that responsibility is huge. But you know what? When you're in it, it doesn't stop you. Like, it's not like I, laid awake at night worrying about the responsibility. You have your processes in place and your checks, and you work at it. But I guess that was the struggle, just that transition from the pharmacy intern, to now I have this piece of paper and I'm a pharmacist. But it wasn't, I can't say that it was bad. It's just that if you ask me, that's what comes to mind. It's kind of funny though. I still remember the day that I got my, we received things in the mail. And so, I got my letter that said you passed, and I was a graduate then, and I had been hired by a company. And so I drove in and I said, I passed, and the pharmacist said, see ya, and he left. That was it. So he didn't need 2 licensed pharmacists there that day. So he went on his way. But anyway, and then what I just mentioned would probably be true with any profession. You've got a patient's life in your hands. So just understanding trying to reconcile with the magnitude of that. You're not the student anymore.
Yeah, that's a really interesting perspective. Thanks for sharing that. There was somebody who asked if you could share a little bit more about your experience and roles during or doing geriatric pharmacy specifically. What led you to that path and why did you choose it?
Well, I had been working in a hospital pharmacy for about 11 years, and long-term care pharmacy was kind of up and coming. And once I got into it, I just absolutely loved it. And what I loved about it was that I was on the team that not just reviewed their medications and made recommendations, but I would get to travel to let's say we started a new nursing home, and we were gonna start supplying them with their medications. So I got to do the setup with them, the education, and so it's funny because every story I tell you, you'll always hear how I got to teach them, I got to show them. It was like the teacher in me has always existed, and I've just always loved that part so much. But the role of the pharmacist in the long-term care setting or the nursing home setting, our role is really to look at that drug profile every month and to really make sure that the nursing home resident is functioning at their highest possible level, and that the medications are helping them do that. And as I said earlier, a lot of times I was saying decrease the dose or get rid of this med because maybe the side effects were causing problems. When I saw the frail elderly and I saw them living, in an institutional setting, I wanted their life to really be the best that it could be. And I wanted to help the people in the nursing home do that. So it was more to me than just the drugs. And actually that's what led me to LECOM. I worked in long-term care for a number of years. I developed my own consulting company where I would go and not just help them with their meds and their med profiles, but like teach them administrative type things too. And I wanted pharmacy students to know how elderly patients should be treated. It's not always just about the guidelines. You know, the guidelines say this drug or that drug. In elderly patients, you start at a certain dose, the lowest dose, and then you kind of titrate up based on their response. And except for an Alzheimer's disease, then we go with the maximum dose. But with blood pressure, with diabetes, it's all based on response. And so yeah, I have a real love for that setting. I still do. But it was a good choice for me.
Thank you for sharing that insight. I think that was really touching, just reason as to why you went into that specialty. And I think it's important that we all develop that when we're looking into whatever profession or whatever specialty we want to. So thank you so much for presenting today. And if you have any final advice or just like notes that you want to throw out there as we wrap up today.
Well, first of all, let me just say how impressed I am with this pre-shadowing group. What, you know, seeing a need for this type of activity for fellow students and creating this is absolutely amazing. So, you know, whenever I first got the invite and I visited your website and I saw what you were all about, I thought I need to be a part of this. And so I'm thrilled. I think I might be the first pharmacist that has spoke, but I'm just thrilled to be a part of it. But for those of you that, you know, that are participating and thinking about healthcare, you know, it was important for me to share my experience with you. And it's important for me for you to see, you know, inside of the mind of a pharmacist and how our brain works and how we really contribute to patient care. And not a lot of people understand it because they understand the traditional, you know, a pharmacist is a traditional role. We've been around, you know, thousands, hundreds of, you know, years. But just knowing that, you know, it's really obvious, you know, what a nurse does, what a physician does, but to a lot of students your age don't understand really the vast opportunity there is in the profession of pharmacy. So it was important for me to come here and share this with you. And I just really thank you all for having me.
Yeah, and if I can I jump in real quick? Yes, thank you guys very much. This is Hannah and I were chatting privately. I echoed Dr. Ogden's sentiments. This is definitely something that's needed in this kind of time. But of course, LECOM is also a college of medicine and a dental school. We also have other master's programs. So and all of our faculty members, especially our clinical faculty members, are really passionate about these various professions. So if you guys need, you know, a point of contact for someone, or even to hear from different pharmacists, you know, Dr. Ogden's geriatric pharmacist. We have pharmacists that are clinical faculty who are in a wide variety of specialty areas. I can help facilitate that should you guys be interested in that. So, and any of you who are interested in pharmacy school specifically and learning more about the admissions process, throw in my direct email in the chat. So feel free to contact me anytime. We'll get you the answers to the questions you have.
Thanks so much, Jordan. Thanks so much, Dr. Ogden.
Thank you so much, you guys. We really appreciate you taking the time to come speak to us. So right now I'm gonna start sharing my screen so we can do the wrap-up presentation. But thank you so much for that wisdom. Just 1 second, sorry. Okay. Let me know if you guys can see my screen. Oh, okay. So we do have a bit of a reflection right here for you guys. This is really for you to take a moment and just reflect on today's session. So I'll leave the questions up here for a few more seconds. You can either take a picture or answer it really quick in your head. Okay. So just to reiterate, you do have the chance to win a free RSVP. This is our PayPal here in the corner for the QR code, and our Venmo is at Pre-Health Shadowing. So this week it is $2 to win the raffle. You can apply as many times as you want. Just remember, act fast, because next week it will go up to $3. Our mentorship weekend is February 19th through the 21st, so it's coming up pretty soon. I'll leave it up here for a few more seconds if you want to donate, and I will announce the winner at the end of this presentation. Okay, so a little bit more about our mentorship opportunity. You get to meet up with 2 established professionals throughout the duration of the weekend. So that's 6 professionals in total. You can gain connections with like-minded students and also gain mentors for life. So this is a really great opportunity, and I highly suggest you try to win that RSVP. And again, it will be February 19th through the 21st, okay? And are you interested in getting published? Because Pre-Health Shadowing does have a wonderful opportunity for you all. So you get to submit either articles or reflections, reviews, success stories, and you can do the submission right down here with this link, and it'll also be in the chat. This is also another great opportunity for you guys to put your name out there and add something wonderful to your applications. And if you're interested in getting a leadership position, we do have an opportunity for you guys to apply to be a part of our student team. It is 100% remote. You get to meet with like-minded students, gain professional experience, and it also does look great on your application. If you do not want to be a part of our team and you don't really have enough time for it, that's okay, because we do have a wonderful volunteer opportunity as well. So this is totally on your time, and you get to work from home. So if you are up at 3 a.m. and you're like, I'm done studying for the night, I want to do some volunteer hours, and put that on your application, go ahead. The QR code is right here. Okay. And help us keep Pre-Health Shadowing free. This is a QR code to help us raise money. So unfortunately, we are having some technical difficulties with our website because of the influx of students that we have. So to help us keep Pre-Health Shadowing free and accessible for you guys, I would suggest helping us, and I encourage you to donate. I'll leave the QR code up here for a little bit. Okay, and if you want to be posted on our official Pre-Health Shadowing website or account, so like you can either make a TikTok, Instagram, Facebook, Twitter, and if you tag us at prehealthshadowing.com or use the hashtag prehealthshadowing, you get to potentially be reposted by us. We do have some wonderful speakers the rest of this week. So tomorrow we have Dr. Bennett at 5 p.m. PST. This is a California-based program. And then February 5th, we have Dr. Rubal, and she's 3 p.m. PST, okay? So make sure you tune in. And for the moment you guys have been waiting for, to get your certificate to verify these hours. So like I said, we're having some technical difficulties uploading the quiz to our website, but we will have it uploaded by 11 p.m. PST today, okay? So to get your shadowing certificate, you just have to find the professionals course by going into all shadowing sessions, and then you're gonna click take this course. It is free. Remember that, it's free. Step 2 is you're gonna take the 30-minute assessment. It's only 10 questions, but we give you 30 minutes so you don't have to stress out. You just have to click start and take the assessment. And then this one's really important. If you get 2 tries to take the assessment. For the first try, if you get a 70% or higher, I would suggest stopping right there and click finish course. If you do not click finish course, you will not get your certificate. So you do have a chance to get another try on the exam if you mess up the first time. But just remember that if you get it the first time and you don't get it the second time, the certificate, we cannot open up the certificate for you. So just stick with the first time you do it and make sure to click finish course to get your certificate, okay? And if you have any questions, my team members are happy to answer them. You can just drop it in the chat. So for the winner of our raffle today, your winner will be Brian Quintero. So congratulations, you do get to have that RSVP for our mentorship weekend. We will email you with some details about it. If you just wanna, if you're here, if you wanna drop your email privately in the chat to either Aster or Hannah, who are our co-hosts today, they will be happy to take it down and send you some information, okay? But if you have no further questions, you guys, feel free to leave the Zoom call whenever you want.